Let's be real, you've probably heard it all by now. When it comes to erectile dysfunction treatments, pills and pumps and weird devices, and even things that sound straight out of the sci-fi movie. But what actually works? That's the real question, right? I've worked with countless men, studied the science behind these treatments, and seen firsthand what works and what's just hype. Trust me, there's a lot of misinformation out there. Today, I'm cutting through the noise and giving you the real answers on what treatments actually make a difference. Whether you're just starting to notice things aren't working or you've been struggling for a while, this video is going to help you figure out what's worth your time and what's not. Let's dive in and stick around to the end because we will also talk about one of the most overlooked solutions that can save you from wasting money, something that many doctors don't even mention. I'll also explain how working with a trained sexologist could be the key to unlocking what's really holding you back. Let's dive in. When it comes to erectile dysfunction, you've got a few key categories of treatment. First, there are meds you probably heard of by now, things like Viagra or Cialis. These work by improving blood flow, and for a lot of guys, they do the trick. Next, you've got devices like pumps or rings. They are more hands-on and usually for guys who want something beyond meds or can't handle the med. Then there's the lifestyle angle, things like improving your diet, exercising, cutting out smoking and alcohol. Trust me, this part gets overlooked, but it can make a huge difference in your performance. And finally, there are newer treatments like shockwave therapy. This one's gotten a lot of attention lately because it's non-invasive and target the root of the problem, blood flow. But not every treatment works for everyone. In this video, I'll help you figure out what could be worth your time and investment. Let's start with the most common option, medication. You've probably heard of Viagra, Cialis, or Cialis. These falls into a category of drugs called PDE5 inhibitors, and they work by boosting blood flow to help you get and keep an erection when you are aroused. But here's the thing, these meds aren't the cure. They don't fix the root cause of ED, they just help you when you need them. For some guys, these work like a charm. You take the pill, it works for a few hours or even up to a day, depending on which one you use. But they come with some side effects like headaches or flushing and sometimes even vision changes. Plus, they don't work for everyone, especially if you've got some underlying condition like diabetes or high blood pressure that aren't managed. Now, there's a bit of myth floating around that taking these meds means you instantly perform like you did in your 20s. Don't buy into that. They're a tool, not a magic fix. If your ED is caused by lifestyle issues or mental factors, you will need to address those alongside the medication for the best results. But if you're just looking for a reliable boost, this can be part of your strategy. Now let's talk about something a lot of guys overlook. Lifestyle changes. You might not realize it, but your daily habits, what you eat, how much you move, even how you manage the stress play a huge role in your performance. Think of your body like a machine. If you are fueling it with junk food, sitting around all day, or running on stress and no sleep, don't be surprised if things aren't working the way they should. The more you take care of your body, the better your blood flow, energy, and your overall health. And that's going to translate to better performance in the bedroom. Simple things like cleaning up your diet, more greens, less processed junk, getting regular exercise, and keeping your stress in check can have big impact. Here's an easy reality check. Imagine trying to drive a car with a parking brake on. It's not going to run smoothly, right? Well, carrying extra weight and unhealthy habits is like putting the brakes on your body's performance. Losing a little weight and getting your body in better shape can make a difference really fast. It's not always easy, but it's definitely effective. And don't forget about sleep. Not getting enough rest messes with your hormones and your energy level, which means you're not going to perform at your best. So if you want long-term results, this is where you start. Pills might help in the moment, but lifestyle changes help for life. Now, if you have tried meds or lifestyle changes and still aren't seeing results, there are newer treatments that are gaining attention. First up is the shockwave therapy. This isn't as wild as it sounds. It's actually a non-invasive treatment that uses low-intensity sound waves to stimulate the blood flow. Think of it like giving your blood vessels a wake-up call. For guys dealing with poor circulation, this can be a game changer. Next one is the platelet-rich plasma therapy, or PRP, which is all about using your body's own resources. Your blood is drawn, the platelets are concentrated, and then injected back into the area to promote tissue repair and regeneration. It's natural, still in study, but lots of guys are seeing results that helps improve their overall function. Again, this is about addressing the root cause, not just masking the symptoms. There's also the options of injection, things like Trimix. Now, I know the idea of injection to penis doesn't sound appealing, but for guys who don't really respond to pills, these can be really effective. These medications are injected directly into the penis to relax the blood vessels and boost the blood flow. It's fast acting, so you're ready when you need to be. The biggest hurdle here is getting over the fear of needle. But a lot of guys find it's worth it when other options haven't worked. These treatments, whether it's shockwave, PRP, or injection, aren't for everyone. And they're usually recommended when most traditional options haven't worked. But if you're someone looking for a long-term solution or something beyond medications, they're worth considering. Just make sure to talk to a specialist to see if they are right for you. Now, here's something really important to consider. If you notice that every now and then you're still getting morning wood, that's actually a good sign. It means that your body and your physiology are working fine, which suggests that the issue might be more mental than physical. So instead of throwing money at meds or tools or surgeries that might not even be necessary, it could be time to look at what's going on upstairs in your mind. This is where an educated sex therapist or sexologist comes in. I've studied both medicine and psychology, but one thing that isn't covered nearly enough in traditional education is the psychosexual aspect of human health. That's why working with someone who's trained to help you unlock those mental blocks can be a game changer. It's not just about treating symptoms, but getting to the root cause. And a lot of times, that root is in how we think, we feel, and we connect. Now, here's the important part. Erectile dysfunction is treatable. Whether it's a quick fix or band-aid like medication, or a long-term solution like lifestyle changes, injection, or cutting-edge treatments, you've got options. The key things to remember is that you don't have to settle for less. Every guy is different, and what works for one might not work for another. That's why it's so important to stay open-minded and explore the treatments that fit your specific situation. You're already taking a huge step by watching this video. So stick with me, don't give up on finding what works for you. The more you invest in understanding your body and trying different treatments, the closer you will get to the results you want. Erectile dysfunction isn't the end of the road. It's just a detour, and there are plenty of ways to get back on track. Alright, so now that you know what's out there, let's talk about something just as important, what not to do. Because the truth is, most guys trying to fix ED are making mistakes that actually make it worse. And if you don't catch those early, you could be wasting years chasing the wrong solution. That's actually what I break down in the next video, the biggest mistake keeping you stuck with ED and how to fix them. Also, if you are ready to take this seriously, I've got a free 3-day masterclass where I walk you through everything step by step, the science, the solution, and how to actually fix this long term. The link is below, so check that out. But first, click here to watch the next video, because if you're making any one of these mistakes, It could be probably the reason nothing's working.